Good afternoon. I hope things are going well for you on this Wednesday. The time now is 12:30. I'm Julie Broughton. We're so happy you're spending a little bit of time with us to get caught up on your news and weather headlines. Our big weather headline for the last several weeks has been the dry weather, our drought conditions, and that lack of rain. Well, the good news as we're taking a look ahead to the next 7 days and beyond, it looks like we are going to see a bit of a pattern shift, and that means we could get some desperately needed measurable rainfall in here, but that doesn't happen till the end of the week. We'll talk about that with your full forecast in just a few minutes. And we'll also catch up with News 6 anchor Bridget Ellison, and she is going to show us a very cool new simulation system Advent Health is using to train nurses. It helps them get a little more hands-on experience before they are dealing with real patients. So she will tell us all about that. But first, the case of a Brevard County teacher accused of attending an out-of-control party with teenagers is moving forward. Now, this morning, the defense tried to get the case thrown out, but as News 6's Mark Lehman tells us, unless something major changes, the trial is set to begin Monday.
The defense looking to get the case thrown out against this Brevard County teacher before it heads to trial. The judge, however, ultimately sided with the state, meaning at this point the trial moves forward.
We are here today on State v. Carly Anderson.
Brevard County teacher Carly Anderson appearing before a judge where her attorney focused on Cocoa Beach police body camera video recorded in January. Anderson was arrested in connection with an out-of-control teen house party and charged with misdemeanor disorderly conduct and intoxication. Her defense arguing the video doesn't support those charges, and the state countered with their own motion to strike, saying the defense failed to show there are no facts in dispute. The judge agreed.
The court does find that the motion to dismiss filed by the defense is legally insufficient.
Anderson is one of two educators facing charges in connection to the party police say involved over 100 teens. According to investigators, it happened at the home of now former Roosevelt Elementary School principal Elizabeth Hill Brodigan. She's been charged with felony child neglect and contributing to the delinquency of a minor. Anderson, meanwhile, faces up to 60 days in jail on each of her misdemeanor charges. Today, the state said a plea offer remains on the table for Anderson, and if she chooses to accept, she must do so by Friday afternoon. So as it stands now, the defense could file another motion to dismiss or decide to take the state up on their plea offer. Depending on the developments, the trial is set to begin on Monday with jury selection. In Brevard County, Mark Lehman, News 6.
Happening today, a bill banning fluoride from Florida's drinking water is heading to the governor's desk. As News 6's Angie Quesada tells us, people who are in favor of the bill say it gives us more freedom about choosing what goes into our bodies, but critics say it could damage people's health.
Several state leaders are pushing for this, and so many cities across the state have already made the move, but the bill would make it universal. It's something that we really don't think too much on, whether we're drinking water from a fountain or we're brushing our teeth in the morning. That water contains some fluoride.
For nearly 80 years, fluoride in tap water has been praised by public health experts. It's credited with slashing rates of tooth decay, especially in kids.
I would say it's the cheapest way to take care of your teeth.
But a bill headed to Governor Ron DeSantis would end the practice in Florida. It doesn't mention fluoride by name, but bans any health-related additives in public drinking water.
This is not about fluoride. This is about your liberty. This is not, sir, about conspiracy. We left conspiracy at the door. Today we deal in facts.
The move has gained popularity in recent months over concerns about possible negative health impacts, especially in children. But critics say that it's a dangerous move that will hurt lower-income families most.
There's a huge concern from the public health community, from the dentist community, that removing fluoride would have serious consequences, including higher healthcare costs. Treating cavities and related infections is expensive, and fluoridation has saved families and taxpayers millions in dental care each year.
If the governor signs the bill, Florida would be the second state in the country to pull fluoride out of tap. Utah became the first state after making a similar ban earlier this year. Angie Quesada, News 6.
If you have teens who play sports, you know a torn ACL is a pretty common injury. Current treatments, though, are painful and don't always guarantee a full recovery and a full return to performance. But CBS News' Dr. Malika Marshall says a new treatment is showing promising results.
At 16, during a Final Four football game, Johnny Sullivan went in for a tackle.
My knee kind of bent and I just felt the pop.
That pop came from the anterior cruciate ligament in his knee. The star athlete had torn his ACL. To repair an ACL, surgeons typically borrow tissue from another part of the body, like a hamstring or quadriceps tendon, to reconstruct the ligament.
Traditional ACL reconstructions can be quite painful. They have a relatively high failure rate, and student athletes can't always return to the same level of performance.
The bridge-enhanced ACL restoration, or BEAR procedure, has become a more attractive option for some. The ligament is repaired, and then this collagen implant that looks like a marshmallow, bathed in the patient's own blood, is inserted into the knee to help the ligament heal.
We get this blood clot, then we get the body that creates the healing response, and then you get a healed ACL, which is really amazing because now we're keeping your own nerves, your own blood vessels.
Massachusetts-based orthopedic surgeon Dr. Scott Sigmund has performed more BEAR procedures than almost anyone in the world. The surgery was FDA approved in 2020 for people 14 and older, but now it's available to school-age kids as young as 7 and 8 who are increasingly injuring their ACLs.
We have these really cool new anchors that are not made out of metal, so literally we don't have to touch the growth plates. In the past, if you injured a growth plate, the leg could actually grow wrong.
15 months post-BEAR, Johnny says his knee is not only restored to the way it was, it may even be better.
So would you say that you're back to being one of the top players on your basketball and football teams?
Yeah, I would say so, yeah.
And back to dreaming about playing at the college level. Dr. Malika Marshall, CBS News, North Chelmsford, Massachusetts.
Looks great. That is great news. We're going to take a short break, and when we get back, we'll have a check of your full forecast, including, finally, looks like we could see some decent rain on the way. And we'll also check in with News 6 anchor Bridget Ellison. She'll tell us about that new simulation training program AdMet Health is using for nurses. Stay with us. We'll be back in 2 minutes.
The Orlando Ballet is closing out its season with one of the oldest classical ballets, but it's very challenging. I'm News 6 anchor and insider guide Crystal Moyer, and I'm showing you how the Orlando Ballet is keeping its dancers on point. The Orlando Ballet is giving us an insider look at rehearsals for their upcoming performance of Giselle. Artistic director Jordan Morris running the program.
It's a beautiful, tragic love story. It has some of the most difficult technical dancing in Act 2. There are sections where there's 21 women all dancing in unison, where every single person is on the same leg, on the same count.
the precision, the clarity of the movement. There's a lot of jumping. There's some incredible partnering going on. Some of the men are holding, the lead role, Albrecht, he has to hold Giselle above his head.
It's one of the most complex and demanding ballets, but you wouldn't know it. Dancers like Cameron Bailey make it look easy.
As dancers, we are pushing our bodies almost past their limitations sometimes.
Orlando Health gives dancers like Cameron peace of mind, not just treating injuries, but offering proactive health care, keeping them strong, healthy, and on their toes.
They can provide massages, provide soft tissue work, provide dry needling, a number of ways that they can just help reduce inflammation, help with muscle soreness.
They have a volunteer team that contributes to helping our dancers on a daily basis.
There's even a physician on site at the theater during performances to quickly respond to any injuries. As the season comes to a close, the Orlando Ballet is looking forward to its Giselle performances with some new choreography and set pieces, as well as live music performed by the Orlando Philharmonic Orchestra.
The Orlando Ballet presents Giselle at the Dr. Phillips Center for Performing Arts May 1st through the 4th. I posted all the ticket information on clickorlando.com/insider. And while you're there, you can get a sneak peek at next season's performances. In Orlando, Crystal Moyer, News 6.
Looks great. Advent Health is using a new simulation system to train nurses, and it gives them the chance to have more hands-on experience before they deal with real patients. News 6 anchor Bridget Ellison joins us now. And Bridget, you got to check out this new simulation in person. It looks really cool.
It really was. They use actors, Julie, and they are hiring. So if there's anyone looking for any acting gigs, you could go and be an actor at the simulation and training labs with Advent Health. But they do this as part of an effort to help support and retain their workforce, their nurses and their health staff. And so it's something where they come in a few hours at a time, throughout their shifts, where they take that time out, come over there for a few hours, do the simulations, and then talk about how, things can be improved. But Florida actually is leading in its efforts to retain as well as recruit more nurses. So our percentages are actually a little bit lower than the national averages. So things like this seem to be working. Let's take a look.
Hi dear, what's going on? Where's your pain at?
This is a simulated bedside nurse visit.
Is this side more comfortable for you? Have you tried going to the other side?
One of several these nurses will witness in this session at the Advent Health Center for Simulation and Education in DeLand.
So what you're seeing today is essentially nurses practicing and fine-tuning their skills in a safe environment. So whenever they're put in that environment, they're competent, they're confident, and they know who to reach out to for help. You need me to page out for Dr. Edward?
Yes, that'd be great. Well, we're waiting. I'm waiting on the call back from your surgeon.
After the simulation, the nurses talk about protocols followed, what worked and what could be improved.
So for my two in the room, go ahead and tell me how that felt.
Even though I've been a respiratory therapist for a long time, being a bedside nurse is a little bit different because you have more one-on-one interaction with the patient.
Andrew Bowman is a new ICU nurse for Advent Health. He helps fill a great shortage. Nurse.org estimates that Florida will only have 88% of the more than 26,000 nurses needed by the year 2030.
We have to be in our best game because with these shortages, we have to take on more responsibility. So that's why things like this are very beneficial, because it puts you in situations that are not uncommon to what you're going to see in regular practice.
And it's not just these actors who help them go through these simulations, but you have these different types of mannequins that are high quality.
Yeah, we have high quality mannequins where the learners can assess for pulses, they can listen to heart tones, they can listen to breath sounds.
Today's resources are helping Advent Health attract more nurses and prepare them for anything.
You hear about it and you read it in a textbook, but till you can actually see it live, you don't know what you're in for.
Bridget Ellison, News 6. And the nurse you met in that story, Mr. Bowman, actually moved here, relocated here with his wife from Ohio. They both have nursing backgrounds, but the incentives to move here, it was not with Advent Health at that moment. It was for another travel nurse position, but that was what initially brought them here. And then all the great benefits with Advent Health were what, caused him to make that move. But he's an ICU nurse in New Smyrna Beach, so you may run into him there. And it's one of those ways that these different hospitals and healthcare groups are recruiting people. They're recruiting people from out of state to try to fill the gap. And so it is actually working, because the surveys from the Florida Hospital Association show that efforts are working. The nurse turnover rates have dropped by 45% since 2022, and the vacancy rate, Julie, improved by more than 60% since 2022. And we did suffer a little bit with burnout and lots of retirements during the pandemic, of course. And there still is a big group of nurses set to retire in the coming years. So that's why, we have these different efforts. There's a midwifery school getting ready to open up. And there's so many other efforts to get more nurses and more people in the healthcare workforce, because we do have growing population boomtown area here in Central Florida.
Yes, everyone wants to live here, and we understand why. That's why we've all been here for so long. But I like seeing the nurses actually interacting with patient or actors playing the role of patients. I know anyone who's had a hospital stay, you remember those really great nurses, because you do have more contact with them than anyone, and they make such a difference, and they really are healthcare heroes. So it's great to see them getting that experience in a safe environment.
It was really nice to watch too, because when they go into the debrief after those scenes, one of the main things they talked about was listening, really listening to the patient. And that's one of the things that's first and foremost. But I wasn't allowed to give the details of some of the scenarios, because it's almost like confidential information for each nurse to go in there and find out for themselves, like what those different scenarios are going to be, because there were some different Easter eggs, if you will, in all the scenarios. And so they got to talk about those, and if they caught those situations with each other in the classroom afterwards. So it was just a really interesting thing. And those high definition mannequins could talk. They can have someone on a microphone, like in another room, speak through the mannequin, and it can have IV fluids. It can give birth, Julie. So they have some really amazing technology.
Yeah, I didn't expect that. I know on News 6 at 9 years ago, we had some talking children mannequins in that were used for some sort of training, but wow, they can give birth too. That's amazing. What a great way to be able to practice these very high stakes scenarios in a less high stakes environment.
Yes, it is. It's really great. So, of course, I have another story I did yesterday about the artificial intelligence that they're using to detect pancreatic cancer, or cysts, and it's very accurate. It's called AIEUS, and that was at Orlando Health's Digestive Health Institute yesterday. They've really expanded out there, so that story is also up on clickorlando.com. But we're a part, the Orlando Health Digestive team is a part of a collaboration with some specialists in Europe right now to test out this technology. Once they've got enough research done, then it will be more widely used and available in other healthcare offices across the world. So we're in an area where we have a lot of exciting things happening. They also have the only place in Central Florida that's doing this shockwave therapy for pancreatic stones, which I hadn't even heard of until yesterday.
No. Wow.
So
yes. We are on the forefront of all of these great things. You hope you never need these options, but man, we are lucky if we do, that we have it all right here in Central Florida.
Lots of great specialists and technology, yes.
All right, Bridget, thank you so much.
Sure.
Let's get a check of your forecast now. Finally, as we are looking ahead to the next several days, we are looking at that potential of getting some rain in here. It's not coming today, but keep our fingers crossed we could actually get some measurable, hopefully drought-busting rain as we move into next week. Here's what the radar looks like for you right now as we are sweeping out. Not finding any showers to track. We weren't expecting any rain today. We have a very dry air mass in place. Satellite and radar imagery showing very little cloud cover as well. Right now, temperature's not too bad. It actually feels pretty decent outside. It's 80 right now in Sanford, thanks to onshore winds. Most of you are in the upper 70s along the coast, 77 in Melbourne, 79 in New Smyrna Beach, and Leesburg is checking in at 81 degrees. As we take you through the day today on your clouds and rain forecast, we'll see any cloud cover moving from east to west thanks to that strong onshore flow blowing those clouds across the peninsula. But again, no rain to track for you for our Wednesday or for our Thursday, but by the time we get into Friday, we'll start to see those moisture levels coming up just a little bit. Now, here's a look at the GFS. It's one of the models we use here as we are forecasting the weather. This is what it is indicating as far as rainfall totals taking you from Sunday to Wednesday. And so some spots, look at that, New Smyrna Beach, right along the coast, Palm Coast. Again, the GFS indicating we could see between 2 and 4 inches of rain in some spots. Now, the Euro not looking quite as generous with that rain, showing most of us picking up less than an inch. As we continue to get closer to that, we will hone in on that forecast a little bit more, but there is some hope we could get some much needed rainfall in here. For today, we'll go to a high of 90 in Ocala. Normal high this time of year is 86. That's where we'll be in Orlando, 88 in Leesburg, and 80 for your high in Melbourne. Here's how it looks for the next 7 days. Rain chances go up to 20% on Friday and then up to 40 to 50% for Saturday, Sunday, Monday, and even into Tuesday, with highs a little bit cooler toward the end of the weekend and into early next week. Meteorologist Jonathan Kegas and I will have much more on your full forecast for you starting on News 6 at 4 this afternoon. Thank you so much for spending some time with us today. If you have any questions or comments for us here, you can head to clickorlando.com/take6. Let us know what's on your mind. Again, thank you for spending some time with us, and I will see you on TV starting at 4.